And with us now is Dr. Kevin Kavanagh. Good morning, Doctor.
Good morning, Jack.
Dr. Kavanagh is a retired physician, founder of a national organization called Health Watch USA. We learned this morning, Dr. Kevin, that the positivity rate in Kentucky is now down to 6.04. Now, I know Fayette County is still in the red zone, as are the counties, many of the counties surrounding Fayette and into eastern Kentucky, but 6.04 positivity rate is a good thing.
Well, it is compared to what it was before. But as I said, Jack, I'd really like to see that below 5. Of course, I'm higher risk than most people. So I agree with the public health commissioner from Fayette County who says at this point, we still probably need to be wearing masks in an indoor setting in Fayette County. But it's headed in the right direction. Kentucky as a whole has 11 cases per 100,000, and we're down 78% over the last 2 weeks. And so that's a very good sign. But we also have in eastern Kentucky some counties that are reporting increases, such as Pulaski, which is up 34%, and McCurry County, which is up 49%. And so we still need in some areas of this state to follow public health advice. And the thing that's frustrating, we're an outlier with the rest of the nation. I mean, Kentucky is one of the 5 states that's probably doing the worst right now, although things are getting better. And my hope is that they continue to do so.
You also, this morning, Pfizer CEO says everybody should get a 4th dose of the vaccine. Talk about that. Or the booster.
Yeah. That's correct. That's right. A 4th dose, which would be a second booster. Of course, if you're severely immunosuppressed, everybody agrees you should be getting that. I kind of go along with the CEO of Pfizer because these vaccines, their immunity's waning. As you know, we initially started out with protection that we were hoping would last up to 2 years. And now we have protection against infections that are lasting less than 6 months, but it's still protection. And so that's key. And the protection against hospitalizations and deaths are better. But nevertheless, with the data coming out on long COVID, the dangers of CNS problems, of cardiac problems, we really need to consider whether or not we should be getting a 4th dose. And I think that's something the FDA will be looking at. Now, on the upside, he also said that Pfizer is working on a vaccine which will cover all variants, and that I think is very good news. He stated that Omicron is able to evade the vaccine protection, and we know that. That's why the vaccine only lasts for a few months, but it's not completely evading protection. But I would keep immunity up as high as possible. As I've stated on Friday, cases in the United Kingdom are increasing, which is kind of disturbing because they have a 74% rate of vaccination. Over a 2-week period, New York Times is reporting they're up 107% in cases.
Why? Why is that? Do you have any idea?
Well, I think it's a combination of 2 things. One is a lot of people were initially vaccinated in the United Kingdom with the AstraZeneca vaccine, which is not as strong as the mRNA vaccine. They are also starting to get hit now with the Stealth Omicron variant, and that's the variant I'm concerned of. The Stealth Omicron variant is in the United States, and cases are starting to uptick. And so that's something we need to watch. And if that continues, that may be the next variant. Hopefully, Pfizer will have its Omicron specific vaccine out, or the vaccine that covers almost all variants out by that time. And that's what I'm hoping for. But right now, if you're living in eastern Kentucky, you're high risk, which is about half of the adult population. Probably not a good idea to let up on public health measures at this point. And certainly if you're in an area that's in the orange or the red, I would recommend still continuing to wear masks in indoor settings, especially if you're going into a retail establishment or someplace that has a lot of people in it and does not have adequate ventilation.
Now, is there actually something called Deltacron?
Well, it looks like there is. The CDC director has said that. That's, to me, kind of disturbing because, as you know, it was originally found in Europe and then it was kind of negated, or people said, well, that's just a contamination. They looked at someone who had Delta and Omicron and just got things mixed up. Well, the CDC director has now stated that there is a Deltacron, which is, of course, would be very bad news. But remember, as we've said before, it's not just being a virus that is dangerous. You also have to be infectious enough that it increases and will rip itself through our population. And right now, this virus has very few cases and the Deltacron isn't doing much. Remember what happened with the Lambda variant? That was very bad in South America, but it didn't do much in the United States. It didn't have the infectivity or the ability to go through our population. Right now, every country is a little different. The population is different on how it can respond to viruses, and the immunological makeup and the variants that we're exposed to are all different. And so it's kind of hard to look at one country and say, hey, that's going to happen over here. So right now, Deltacron doesn't look like it's going to be a huge factor in the United States.
Well, that's good news.
Always good to talk to you, Doctor. Thank you, and we will speak to you again on Friday.
All right. Thank you, Jack.